PRN breathing treatment. All you gotta do is give it to them. And the doctor is gonna chew you out if you call it. And you've got a PRN breathing treatment. Now, if you give the PRN breathing treatment and they're not getting any better, that's a different tale. And it takes breathing treatments, 20 minutes sometimes to help. All right, so now your standard adverse reactions to a bronchodilator are tremors, that make your hand shake, and tachycardia. It does it to everybody. Everybody. And the tremors can make the patient not be able to go to sleep at night, or the fast heart rate. And so, you know what? Listen to this. We kind of call those acceptable side effects of bronchodilation, because everybody gets them. The only time it would not be acceptable would be if your patient already ran a fast heartbeat and it put them over the edge. And so your doctor may say, take their heart rate, take their apical rate before you give the treatment, or before they take the bronchodilator, and afterwards, and let me know what it is. He's got somebody that's already got a fast heart rate and wants to see how high up it's pushing them. Okay? So everybody understand that. Bronchodilators can interact with beta blockers, amphetamines, ephedrine, which is found over the counter, and it's used to make what? Meth. Atropine and ditch. So what are we gonna check with the bronchodilator? We're gonna check lung sounds. When would we give it? Is a bronchodilator gonna do anything for fluid in the lungs? No, not one daggum thing. What drug do we give for fluid in the lungs? Lasix, a diuretic. So if we need to dilate the airway and make it bigger, then what lung sound are they gonna have? A wheeze. They'll be wheezing from narrowed airways. And we give the bronchodilator and we open them up. Your asthma patients, the standard thing is wheeze on expiration. They don't wheeze when they breathe in. They can't get air out. Do y'all remember that commercial where the little girl said she felt like a fish out of water and she had asthma? Okay, so they wheeze on expiration. They can get air in, but when they try to get it out, they wheeze. And you know, it's a really bad thing when you go to listen to your stethoscope and you can hear them wheezing before you even put it down. Or they're wheezing in every lung field, all over. Okay, you got a bad patient. Patients die from asthma every day. Never take it lightly, never. You stop what you're doing and you deal with this patient till you see it all the way through and they're better. Okay? They may have breathing treatments that they can have every 15 minutes until they're better. And that may be what you do until they get better. Okay, don't go off. All right, so your nursing diagnosis and effective breathing planning, because everybody can get those two side effects. These medicines are usually not stopped because of them. They're viewed as acceptable side effects unless the heart rate is already fast. Okay? Implementation. Now, look at your route, because these meds can be given a jillion ways. You can have PO, you can have per rectum, you can have suppository, especially in children. Inhalation, IV, injection. So make sure you got the right route. That's one of your things that you check with your meds. Evaluation lung sounds. Did the wheeze go away? Did the wheeze go away? They may be left with fast heart rate and shaky hands, but hey, they can breathe, right? They can breathe. Patient teaching. Now, Advair is an inhaler that contains two medications. It contains a steroid, an inhaled steroid, and a bronchodilator. All right? Anytime your patient is on a steroid that is inhaled, what did you learn in chapter 34? They gotta wash the mouth out because it'll give them bad thrush. And thrush is that white stuff that grows on it, that looks like cotton that grows on the inside of the mouth. Had a patient that was admitted to the hospital with thrush in their mouth. And you know what? Upon questioning, she was on Advair and nobody ever told her to rinse her mouth after she used it. That is pitiful.
My daughter, I wouldn't told it about my daughter either.
That's pitiful, isn't it? Okay, so give them all their other meds, then do their inhaler, and then have them take a drink. Or you can do the Advair first, and every time they swallow the medicine, they're taking water, they're washing their mouth out, aren't they? Okay, all right. And even breathing treatments can speed up the heart rate and make them shake. And you want to tell patients that these medicines are going to speed up your heart rate and give you tremors, so they don't constantly call the doctor's office. Everybody's going to do that. They're acceptable side effects of bronchodilation. All right? Look at your bronchodilators at the bottom. Breathine, also known as terbutaline. This one, if you'll put a little dash, is given sub-Q. You'll get COPDers in with wheezing, and they'll have an order for breathine shots every 15 minutes until relieved. So all you do is pull up one, give it, wait 15 minutes, well darn, they gotta have another one, pull up another one, you know? All right, Theodure or theophylline. Ventolin or albuterol. That's your inhaler there, your Ventolin or your albuterol. Okay? All right, any questions about bronchodilation? We beat that into the ground. All right, now steroids. Steroids are always, I'm gonna say always right now, you'll learn one other reason they're given in your cancer chapter. But right now, we're gonna learn that steroids are always given to decrease inflammation. If I get out in my yard and work in my flowers and I get poison ivy, I go to Dr. Kathy and ask for a Medrol dose pack. If I get pneumonia, they're giving me Solumedrol IV push. Where's the inflammation then? In my lungs. So anytime a steroid is given, it's given to decrease inflammation. Until we get to next semester and we'll learn one more reason. All right, so whatever. Now, a jillion side effects to steroids, and you gotta know them all. So highlight these. That's why we're only doing one class. So let's start out. Sodium retention. And if I retain sodium, what am I gonna also retain? Water. So there's the next one. And if I retain water, what does it do to my circulating blood volume? Increases it. And if I have more fluid to get through that same tube, what's it do to my blood pressure? Increases it. That's hypertension. So you see the reason behind that? Sodium retention, water retention, which leads to hypertension, okay? Edema. Your ankles will swell. Mood swings. Has anybody ever been on a steroid and terrible mood swing? You're crying one minute and you're on the top the next. All right? Elevated blood sugar. Now highlight that one big time. I can be in the hospital, because I was with COVID pneumonia, and they're giving me steroids, IV push. But dadgummit, they're coming in and checking my blood sugar just like I was diabetic. And the patient will say, they'll panic. They'll say, well, why are you checking my blood sugar? I'm not diabetic. You're checking their blood sugar because steroids elevate blood sugar. And they may even, for a short time, have to go on insulin until they come off the steroid. And they freak out. And that's one of the most common things that they do. So make sure you know that, so you know to teach patients that. No, you're not diabetic yet. The steroids you're getting for your pneumonia will elevate your blood sugar. And we have to bring it down with a little bit of insulin until you get off your steroids. Okay? All right. They can cause wounds to not heal. Delayed wound healing. They can mask the subtle signs of infection. Let me give you an example of that. My mother-in-law laid in the bed sick for 2 weeks and nobody ever called me and told me. So when I went down there, you know, she didn't have a fever or anything. but she had pain at McBurney's Point, and by the time I called an ambulance and got her to the hospital, she had a ruptured appendix. If they had said anything at the beginning, I might have known. You know, temperature, she might have, but guess what? She takes steroids every day, cause she has inflammation in the arteries in her brain and has to take steroids every day. So the steroids mask the subtle signs of bad appendix. She didn't run elevated temperature. She didn't have severe right-sided abdominal pain. Okay? So you see what it means about mask the subtle signs of infection? Okay? Osteoporosis in women, steroids, prolonged steroid use. Abdominal pain that can lead to GI bleed. Okay? Acne. You take a lot of steroids because you got a bad case of poison ivy and you're gonna develop steroidal acne, and it's hard to get rid of. And they can slow the growth in children. That's why children that have asthma, they don't give them steroid syrup until it's the last thing. Okay? So, highlight those, and you gotta learn them all. And when you're drilled on a steroid in clinical, we'll want them all. Okay? Because the patient can have any of them. Drug interactions, it reacts with so many drugs we didn't even put it on here. You need to look it up. Assessment, where is the inflammation, and then under evaluation, is that inflammation clearing up? If it's in the lungs, I'm gonna hear abnormal lung sounds, right? So as I give the steroids, are the lungs clearing up? Alright? And IV steroids are one of the IV push medicines you can get. And we'll learn how to give them IV push in our IV class. Okay? So planning, what's the route? What's my blood glucose, even if they're not diabetic? Because it's gonna push it up. Okay? Alright, if it's inhaled, is my child young, do they need a spacer? Okay? Now, look at this, and I think you learned this in chapter 34. If your patient is on 2 inhalers, a bronchodilator and a steroid, which one do you teach the patient to do first? The bronchodilator. Because it opens the airway, so the steroid goes deeper into the lungs to heal it. Okay, and you gotta remember that as a nurse, to give it that way, okay? And if they're on a PO dose, like a Madrol dose pack, take it with food, so you don't get abdominal pain that can lead to GI bleed. And that's under your patient teaching. So look at your steroids. Decadron is dexamethasone, deltazone is prednisone, so your Madrol is methylprednisolone. You see they're ending in O-N-E? Even if they're a big name or a short name, they're ending in O-N-E for steroids. Any questions? All right, next Wednesday, okay? All righty. All right, let's take a 5-minute break.